All right.
People watching.
Welcome to the Ask Dr. Collins show. We've got some questions from DM and through the week. And also to let you guys know, on Instagram, we're also going to start including the stories that you guys, or the questions you guys send in the story. So you'll start seeing in our story little questions, and then I'll do answers for them as well. So if we don't get to your question today on this episode, you will start seeing them in our story, and we'll tag you guys in it as well. So I'd also like to use the platform to kind of shout you guys out. If you have a cool account, especially if you're a doc or you're in the health, you're a health practitioner and you have a cool account and you shoot us a question, I will mention and feature you on our story with your questions and also on these episodes. So let's get rolling.
Getting a lot of love already.
Thank you guys.
Your dog though, with the little winky kiss face.
He's
so
so cute.
Hello mate, hey doc. Just lots of stuff. I'm gonna get started on the questions though. If you have more, remember, type them in. At JoanWoo22 asks, where did you go to school?
I graduated from University of Central Florida with my undergraduate, and then I went to Palmer College, which is sort of like our Harvard, not to name drop, but within chiropractic, Palmer is sort of the name brand main school. And that was in Port Orange in Florida. So I got to surf while I was in school. It was pretty amazing. I actually got to stay in a little apartment on the beach.
At Felicia Alexander Branch 926 asks, do you have to do a lot of continuing education?
So any chiropractic physician in the state of Florida will have 40 hours of continuing education that they need to accomplish every biennium or 2 years. So most of us will split that up over a 20-hour each year and go to continuing ed seminars. So yes, and it will range all the way from like record keeping stuff to how to stay out of trouble and keeping up with what's going on in the profession and insurance and different things.
Brianna Joy 143 is saying, it's so nice to see you. God
Thank
bless
you.
you and your family.
Thank you, Brianna.
And then we got a live one at TPinky101. Do you ever work at children's hospitals?
I do not. So I'm in private practice. I have my own little office in downtown Stewart, and that's what I do 3 days a week. So actually now we're more like 5 days a week, but it used to be 3 days a week. But I do see pediatric patients in the office. So I see kids. The youngest kid I've seen was 2 weeks old, and then I've seen people all the way up to, I had a 100-year-old patient a few weeks ago. So.
At Snackosaurus asks, what do you think about acupuncture?
Acupuncture is good. It's an interesting art. So you're basically rerouting pain pathways. Your body is an electrical system. It's you have wiring all through your body. That's what your nerves are. So if you have pain, if you have an area of damage, it tends to suck up a lot of that energy, and that's the pain that you feel. It's like robbed, stolen energy. So acupuncture, and I don't fully understand how they do it, but they have a way of rerouting those pain signals and pulling energy off of that to create less pain for people. So I think it's a good thing, but first you need to get your neck checked so you can open that posture up and not build up the damage that leads to pain. It's good pain relief, but you got to fix the problem too.
At Brianna Joy 143 again said, hey, yes, I'm so happy you saw my comments.
Yeah.
You're welcome. So if you
Awesome.
send a comment, we'll give you a shout out.
We'll give you a shout out, definitely.
At Lubna95MH, how long did it take for you to become a doctor?
So my undergraduate period, it took me 5 years. You're supposed to do it in 4, but I'm sort of, I like to travel and surf and do different vacations. So I did that through college. Parker's just chilling. So it took me 5 years to get through undergrad, and then the chiropractic, it's basically kind of like medical school, but for chiropractors. Our schooling is a 4-year period as well, but the program I was in, they pack it in 3.5 years at Palmer. So it took me a long time, 8 years.
At Donna Kluge asks, what exactly do you do in your office? How do you manipulate the body?
So manipulation, that word specifically, is kind of a hot button word, and it is typically associated with cracking or popping joints. And osteopaths do it, chiropractors do it, PTs do it. The kind of work I do, even though I'm licensed as a chiropractic physician, I went to school to do upper cervical or atlas care. So what we're doing is taking very specific cutting edge imaging of the head and neck that is analyzed in engineering-based software, and then I go into the actual room to correct the upper neck. And I don't do that even with my hands. It's actually an instrument that is mounted to the head of a table, and it releases a sound wave into that joint at the base of the skull to improve the head-neck alignment. And it takes pressure off locally with the nerves. It opens up blood flow and stuff, but over time, it also can help a lot with low back pain, joints, knees, all kinds of different things. So
we have a lot of questions coming in.
Wow.
So, okay.
Awesome.
Mike AJ asks, what advice do you have for college students like me that want to go into chiropractic?
I'd say make sure it's really what you want, because it's a hard profession where medical doctors have their residencies paid for by drug companies. They kind of get the hookup. They just have to work a lot of hours. Make sure you want to fight the good fight, because you have you have to be a fighter. You have to really care about people. I would say make sure your head and your heart's in the right place. And if it's there and you really want to be a servant, don't do it for the money. Don't do it for what you assume it's going to be, or that doctor Instagram lifestyle. It is nice being a doctor, but it's hard work. So if all that's in the right place, then I would start going and shadowing in a lot of different kinds of chiropractic offices. I would try to find everybody that's local to you, hang out in there for a few days and see if chiropractic is really what you want to do before you sign on that dotted line and you commit to being in chiropractic school for all of that time and being in all that student loan debt. And if you have somebody who's going to be paying for it, awesome. But just realize you're going to have a big student loan debt, so get ready to serve the world, not necessarily be super, super rich.
TPC 101, how do I relieve tension in my knees from growing pains?
That's a cool question. I would try to steer you away from things. Okay, so think inflammation. Anytime somebody has pain, you can't change that your body's growing. That's like the given, but you can decrease how much pain you feel from it. So I would stay away from sugar, and then I would try to do more of an anti-inflammatory diet. So you can look that up on Google. I won't break that all down, but it's going to tend to be more Mediterranean oils and fish and stuff like that. Stay away from sugar, bread, carbs, things like that.
Cedric Allen is asking, how early in life can you bring your child for an adjustment?
Immediately. So babies are the easiest to adjust. You don't even have to take x-rays on a baby. So once they start to get a little older, like 2 years old, or if they're like a super complex case, torticollis, something emergency, doctors will take x-rays, but usually a pediatric patient, you can adjust basically with the force of your pinky. So it's bring them in right away. If you saw, I don't know if you've had kids yet, but if you saw what MDs will do to a baby's neck, especially in a C-section to get them out, a lot of people can be nervous about the thought of a chiropractor touching their kid's neck, but if you saw that and then you saw the gentle influence that a good chiropractor will use on that baby's neck, you would not even think twice, but instantly.
Brianna Joy, 143 again, has...
Thank you, Brianna.
Do you have plans to visit the Philippines to help people, sir?
I've thought about going to Fiji for surfing, to be honest with you. That's kind of selfish, right? That's not
She hopes you grant that wish.
Aww.
And says thank you.
I appreciate it.
And then one of our patients, Kelly, gave us a wave and a shaka bro.
Kelly.
And said it works. So Kelly, we're going to call you and get you in because we miss you.
Yes. Kelly knows what's up.
@Barger10 asks, do you ever have students come and shadow you?
Yes. So at this point, we're getting so busy that I really want to reserve that time because I put a lot of energy into students.
Got a response about the baby adjustment question.
Cool.
He is an OB/GYN. So
awesome. Yeah. Just find a good chiropractor. You need to have a good conversation with them and make sure that, just like anything, you have bad plumbers and good plumbers. Find a good chiro that's going to be adjusting that baby. Make sure they're good. So I do have students that come into the office, but we're getting so busy now and there's so much going on. I like to reserve that for people who may be looking to be an associate in the office. So I have preceptors, I have students that come in. I invest a lot of energy into them because I want to help them change the world. So I don't kind of passively just have people hang out. I really want to make sure if they're in the office, they understand why chiropractic is important, why upper cervical is so important, and I want them to leave getting a lot. So yes, but if they really want to work in the office, which is a good segue, we're looking for an associate. So if you know a chiropractor, if you follow us, if you're in chiropractic school, if you are going to be graduating, or even if you are still early in school, I want you guys to reach out to me and shoot me a DM, and let's start having a conversation and talking.
We got a cool question from Josh at Rocket Sound Media, who is a video editor. He's trying to bring value to local chiropractors in Georgia with his company, and he's asking, how can I show practices the importance of marketing with videos, and how has it improved your practice?
So I checked out his page. He actually has a really good page. He's a good videographer. So Rocket Sound Media, Josh. So it's a lot of times chiropractors are so busy being a chiropractor, they're looking for like a quick way to get patients in the office. I would try to find somebody who is on the wavelength. I'm 33, I'm a little younger. You want to find somebody who understands that chiropractic is more than just getting patients in the door. It is teaching the world to move in the direction of taking care of the spine, eating good food, wellness versus drugs and surgery. So for us, it's all about spreading that message and helping be available for people to understand that. So you want to find a chiropractor that's already on that wavelength more than trying to convince them. You can't sell the unsellable. But what you have the ability to do, Josh, is monumental. Getting out what chiropractic is and real health is one of the most valuable things in our society and in the world. So just look for those doctors that just need your help in implementing and already have that passion for chiropractic and helping people so that it can get out there, like what we're trying to do. But understand that not all chiropractors are like me. A lot of these guys are just, not a lot of them, some of them are just, it's a business for them. They went to chiropractic school, maybe not for the best reasons, not to sound all high and mighty, but you got to find somebody who's on the same wavelength.
We got a live question. At Divya SW asks, in which cases should MDs refer to chiropractors?
So chiropractic is so non-invasive. I would say specifically upper cervical. So I differentiate chiropractic from upper cervical specific work like what I do. So I'll speak to that. Any patient that is experiencing any kind of head, neck, cranial nerve, blood flow, blood pressure, stuff that you would usually just throw a med at them for, you should have them go look at somebody who works on the alignment of the bones at that brainstem area, which is an upper cervical doc. On the other side of that, from a posture standpoint, when your atlas is out, you're going to have things like, because the body's twisting and compensating to keep that head and eyes level, you're going to have a lot of weird musculoskeletal problems, low back pain, neck pain, shoulder pain, trigger points. So anybody who's coming in with musculoskeletal pain, fibromyalgia, like back pain, neck, like they should see somebody who does postural corrective work to help with the musculoskeletal system before we're throwing drugs at them. So that would be an easy answer. Neurologic stuff around here, and then posture, pain, musculoskeletal.
Brianna Joy 143, last question, sir.
Thank you.
What do I eat and drink to maintain my health? And don't be sorry for being talkative.
Yeah, thank you. We appreciate you reaching out. So it depends. It's a little different for everybody. I can say blanketly people should stay away from certain things like sugar, white flour, processed things, not real human food. You should stay more native. It sounds funny to say, but there was a really good book by Weston A. Price called Nutrition and Physical Degeneration. He was a dentist that went around the world in the 20s and took pictures of native cultures. And anywhere from remote Irish villages to Africans to people in like the Philippines, like remote cultures. I think it was Papua New Guinea actually. He went all over the world, and those people that had never had white sugar and flour had perfect teeth, had no degenerative like cavities. Their skulls were perfect, but their cousins who had white flour and sugar, their nasal cavities changed shape, they had cavities, their teeth fell out, they had bacterial problems, their bones changed shape. We don't realize how degenerative and why people have all of these itises and inflammatory autoimmune problems sugar, white flour, and processed stuff is. So that's in general. Beyond that, once you start, if you're going to be native, you need to really eat food that your body is capable of digesting and eliminating. And that tends to be where your heritage is from. So if you took an Eskimo and you fed that Eskimo a Filipino rich diet, they would get sick and have autoimmune problems and be fat and unhealthy. You need to eat locally and regionally. So if your heritage, you guys have eaten certain things through the years, that's the kind of stuff, whether it's fish or roots, eat your diet. Where you get in trouble is what we do in America, where everybody that's from everywhere eats the same stuff. So in America, you have a lot of obesity, you have a lot of autoimmune problems and inflammatory conditions. Stay native, stay unprocessed, eat vegetables, eat seeds, eat nuts, eat locally grown stuff and good quality meats. So that would be the general idea.
Another question from at Mike AJ, who he was the one thinking of chiropractic school.
Cool.
Where did you go to chiropractic school, and what did you think of your school?
Palmer's a great school. It's in Florida. They're accelerated and they're smart and they get you through boards and they help you. Chiropractic school now is not what chiropractic school was 100 years ago. So just be ready to go to chiropractic school so that you can pass your boards and get licensed. That's really the main thing. It helps you get the general knowledge. And then the reason I told you to go shadow is you want to figure out what you want to do before you go to chiropractic school. So if you want to be a foot guy or a pediatric chiropractor, or you want to do atlas work, whatever your heart is, maybe it's sports, like you'll find your niche that you're passionate about. Find a doc and shadow them and spend time with them, because you're going to need to be in a secondary program while you're going through chiropractic school. Chiropractic school will help you generally and get through boards, but you're going to want to have, like I was doing an atlas program while I was going through school.
And then Divya SW said thank you for
You're
answering
welcome.
her question.
Yeah, of course.
And she loves your channel.
Thanks.
At Ishmael asks, Doc, what do you think about studying in Australia?
Australia is pretty tight though. They're really cramping down on chiropractors. There's things you can't advertise. I know of a guy who had a really big channel on YouTube that's an Australian chiropractor that has actually had to stop and kind of redirect what he was doing because he showed himself adjusting a child, which is totally fine, but in Australia it's, I guess, sketchy. Like they'll shut you down for doing it. So you can study and practice in Australia, but just be ready for a tougher fight. Not everybody agrees with chiropractic.
Got a lot of school questions coming
Cool.
in this week.
Yeah.
So at Kayla Loves You 1 asks, what were your subject choices for your undergrad?
So in undergrad, I knew I wanted to open up my own practice from the time I was in undergrad. So I had all of my prerequisite courses that I needed to get into Palmer, which were like your natural sciences, chemistry, A&P, all of those natural science classes. But I also enjoy learning about people, so I was a psych minor. And then the other types of classes that I was doing as a part of a minor were health services administration classes, aka how to run a practice. So that's what I was studying.
At Ilyas Ali Abdi asks, what is this procedure you do and what device do you use?
So it's a lot of words, but the umbrella, all right, chiropractic, the subspecialty within chiropractic is upper cervical chiropractic or Atlas Care. The actual procedure that I do within Atlas Care is called advanced orthogonal. Orthogonal means right angles. So it's an advanced approach at bringing proper alignment, right angles to the head and neck with the Atlas point being the pivot. So
getting a lot of thank yous for all
of course.
The questions.
Thank you guys for taking your time and giving us your attention and like having a conversation.
Lou says hi.
Hi.
And then the last question that I have, if you have any more, send them write them in as a comment.
Yeah, if you guys have any questions, go ahead because we're getting ready to wrap
We're going to
up.
wrap up. At Lubna95MH, what advice can you give me about getting into med school? Lots of school questions.
I am not a huge fan of med school, right? So I'm a chiropractic physician. The two distinctions are, and nobody ever really breaks this down for you, usually people go into their college path or profession for almost superficial reasons, like maybe they knew somebody that was a medical doctor or a nurse or an engineer or something, and it seems like the best thing to do, or they read a report in a blog or something that said that that's a high-paying profession, or they like math more than they like science. You know, there's like these real kind of loose reasons why people go into things. When it comes down to it, I chose chiropractic because your scope of practice, meaning what you're going to be doing day to day with people, a chiropractic physician in the state of Florida is allowed to treat conditions of the human body by correcting and improving the frame, the spine, the skeleton, and the nervous system, and improving its function naturally, and using food and supplements instead of drugs to improve body function and treat and create health in the human person, right? The scope of practice for a medical doctor in the state of Florida is to prescribe a legend drug, so a chemical that was made by a chemical company, or perform a surgical procedure, and in the case of like oncologists, do things like radiation as well. So in the face of those two things, and nothing against medicine, like they save lives, they're there for emergencies, but day in, day out, I wanted to treat holistically and work with people to improve their health naturally, because that's kind of where my head is and what I believe. So if you do want to get into med school, you need to apply and you need to go through that. You're going to have to take MCATs. I don't know how it is overseas, but there's things you're going to have to do. You need to look up the specific protocol for how to do that.
At Ishmael, hemangioma, treatment, question mark. So do you know what that is, and do you know the treatment for it?
Okay, so any kind of, this is a whole conversation about cancer, and it's like a wide open, any kind of cancer in the body, you want to improve the immune system function. So look at it more like a metabolic disease. In the US, you can only treat cancer with chemo, radiation, and surgery. Like a medical doctor will lose their license if they recommend something like Gerson Therapy. More recently, cannabis is getting press and good research with cancer, but still, a medical doctor, if they talk about treating cancer, needs to do chemicals, radiation, or surgery. So I can't speak to that, or I would lose my license too, but I would tell you, not in terms of treatment, but in terms of improving the function in the human body and improving the immune system and making the body naturally healthier, because that's what I'm allowed to talk about. You would want to work on diet. Gerson Therapy is really big on a lot of fruits, vegetables, juices, organic stuff, removing toxicity. So most people are toxically overloaded, and that's why they're sick. Their liver can't even remove all the toxins that are going on, and they're undernourished. So most people are not getting enough nutrition, even though they eat a lot of food. They don't get a lot of vitamins and minerals and the right things from food anymore. So Gerson Therapy is probably the most documented approach with cancers in general, and their two pillars are removing toxicity while flooding the body with nutrition. So that's where I would tell you to start. Start looking up some of the holistic cancer treatments. That's kind of where I have to shut my mouth so I don't get in trouble. So.
All right, we've got two questions real quick. They're kind of similar. Joan at JoanWoo22 asked, do you like your job?
I love my job, but it's like the most fulfilling and hardest thing I've ever done, because our entire culture in the US is built around drugs and surgery. So every day I'm kind of going against the grain and trying to really adjust the way people's minds are so that they're in a holistic mindset. We'll have holistic patients that come in for wellness and understand what I'm doing, but a lot of the work I'm doing is going head to head with people's mentality and helping them understand that chemicals and surgeries aren't the best way to achieve optimal function in a body. It's other things, more holistic things. So I love my job, but it's really hard.
And at D Royudi asked, what made you want to be a doctor? What are your goals with your job?
I wanted to be a plastic surgeon initially because I thought they made a lot of money and I thought it was cool. And then when I was in undergrad, I had a doctor that did the kind of work that I do now, correct my neck and help my brother as well, who was born cerebral palsy. And then after that, everything changed. I knew I wanted to do that. I didn't want to be a plastic surgeon. That was superficial and I was young. So that really propelled me into the direction, even though culturally, like medical doctors have a lot more authority. They're like the cool kid at school. Everybody looks up to them. I knew that I didn't really care. It was more important to me, I should say, that I was doing something that I knew worked and that I believed in, more than if people respected me right off the bat, because I knew if I could talk to people enough and get the word out, the kind of work I'm doing would make more sense to people, and it will over time evolve, and it's going to become the norm where drugs and surgery are not.
So at Ishmael said he's in medical school second year. He loves you very much.
Right
and
on.
You motivate him a lot.
Right on.
And then we got
Be a
question.
holistic MD, please. Look into holistic stuff. You have the power to help prevent people from being on the wrong drugs or too many drugs. Pick the right drugs at the right time, please.
So we have one more question at Wild Will 32. Where is the puppy?
Where's the puppy? He is sleeping.
Parker.
Yep, that's it.
There he is.
That's all he can do right there. That's all he does.
At Iona, what do you recommend to a 28-year-old woman with medium kyphosis? Cyphosis.
I'll shoot you a DM.
Shoot us a DM.
Yeah.
We should wrap this up. It's getting kind
Yeah.
of long. What's going on in the office?
Thank you guys for so many questions. Shoot me a DM so I don't forget, please. So thank you guys for your questions. Like, I think we've had more questions this time than ever before. I really appreciate you guys taking the time and sending all these questions in.
Chiro Coffee says, you're the man.
Chiro
You gotta
Coffee.
check out that
I've seen your
coffee.
page and I love it. Shout out to, what is it, Chiro Coffee? Chiro?
No, Kiro.
Kiro Coffee. You guys should check it out. I've seen their account and I love it.
Yep.
Shout out to Chiro Coffee or Chiro Coffee. So, all right. So this is what's going on in the office right now. A few things, just to give you guys an update, and then we're going to wrap up. So one is we have a dinner workshop. If you guys are anywhere local around South Florida, Monday coming up on the 31st, I'm going to be doing a presentation. I actually have a dinner. It's really lovely, and potential patients and friends and family of existing patients come in. They get to meet me and we talk. So if you guys are local, I would love for you to come. Just reach out to us and we can reserve a seat for you and your family. Two, be on the dinner, and that's on the 31st. Sorry, at 6:30. Two is we are actively looking for an associate, somebody who can take x-rays. The practice is growing and we need help. So if you guys know of anybody who is local around Stuart, Florida, which is like by Palm Beach, if you guys are following us from around there, shoot me a DM. I would love to talk to you because we're looking for an associate. If you are in school, I want you guys to hit me up and let's start having a conversation, because I want the practice to grow so we can see more people and help correct what's going on with their necks. So those are the two big things. Was there another one? I don't think so.
Just a lot of love.
Stay tuned for this around this time next Thursday. We may start doing this a little bit later. Usually it's around 11:30, but I think we got a lot more engagement today. So we'll keep you guys updated. Check in the story. You'll see a little shout out for when this is coming. What is it?
Send in more questions.
Shoot in your DMs, and if we didn't handle it today, you'll start seeing in our story. We'll answer your questions in the story as well. So.
And you got hi doc. God bless.
Hello. God bless you too. Thank you. I received that. Bye guys.